Why do we fall ill? Learning about prevention of diseases. Organ specific and tissue specific manifestations. The disease causing microbes enter the body through different means. The body is very large when compared to the microbes. So there are many possible places, organs, or tissues where they could go. If they enter from the air via the nose, they are likely to go to the lungs. This is seen in the bacteria causing tuberculosis. If the lungs are the targets, then symptoms will be cough and breathlessness. If they enter through the mouth, they can stay in the gut lining like typhoid causing bacteria, or they can go to the liver. If the liver is targeted, there will be jaundice. An infection like HIV, which comes into the body via the sexual organs, will spread to lymph nodes all over the body. Malaria causing microbes entering through a mosquito bite will go to the liver and then to the red blood cells. The virus causing Japanese encephalitis or brain fever will similarly enter through a mosquito bite, but it goes on to infect the brain. If the brain is the target, we will observe headaches, vomiting, fits, or unconsciousness. An active immune system. An active immune system recruits many cells to the affected tissue to kill off the disease-causing microbes. This recruitment process is called inflammation. As a part of this process, there are local effects such as swelling and pain, and general effects such as fever. In HIV infection, the virus goes to the immune system and damages its function. Many of the effects of HIV/AIDS are because the body can no longer fight off the many minor infections that we face every day. Instead, every small cold can become pneumonia. Similarly, a minor gut infection can produce major diarrhea with blood loss. Ultimately, it is these other infections that kill people suffering from HIV/AIDS. Principles of treatment. There are two ways to treat an infectious disease. One would be to reduce the effects of the disease, and the other to kill the cause of the disease. For the first, we can provide treatment that will reduce the symptoms. The symptoms are usually because of inflammation. For example, we can take medicines that bring down fever, reduce pain, or lose motions. We can take bed rest so that we can conserve our energy. We need to be able to kill off the microbes. One way is to use medicines that kill microbes. Microbes can be classified into different categories. They are viruses, bacteria, fungi, or protozoa. Our cells may make new substances by a mechanism different from that used by bacteria. With the help of antibiotic drug, we can block the bacterial synthesis pathway. Similarly, there are drugs that kill protozoa such as the malarial parasite. One reason why making antiviral medicines is harder than making antibacterial medicines is that viruses have few biochemical mechanisms of their own. There are now effective antiviral drugs, for example, the drugs that keep HIV infection under control. Principles of prevention. There are three limitations of this approach to deal with infectious disease. The first is that once someone has a disease, their body functions are damaged and may never recover completely. The second is that treatment will take time, which means that Someone suffering from a disease is likely to be bedridden for some time, even if we can give proper treatment. The third is that the person suffering from an infectious disease can serve as the source from where the infection may spread to other people. It is because of such reasons that prevention of diseases is better than their cure. There are two ways, one general and one specific, to prevent each disease. The general ways of preventing infections mostly relate to preventing exposure. For airborne microbes, we can prevent exposure by providing living conditions that are not overcrowded. For waterborne microbes, we can prevent exposure by providing safe drinking water. This can be done by treating the water to kill any microbial contamination. For vector-borne infections, we can provide clean environments. This would not, for example, allow mosquito breeding. In other words, public hygiene is one basic key to the prevention of infectious diseases. Always try increasing the immune system. The second basic principle of prevention of infectious disease is the availability of proper and sufficient food for everyone. These are the general ways of preventing infections. These days, there is no smallpox anywhere in the world. But as recently as 100 years ago, smallpox epidemics were not at all uncommon. In such an epidemic, people used to be very afraid of coming near someone suffering from the disease since they were afraid of catching the disease. However, there was one group of people who did not have this fear. These people would provide nursing care from the victims of smallpox. If you had smallpox once, there was no chance of suffering from it again. So having the disease once was a means of preventing subsequent attacks of the same disease. Many such vaccines are now available for preventing a whole range of infectious diseases and provide a disease-specific means of prevention. There are vaccines against tetanus, diphtheria, whooping cough, measles, polio, and many others. These form the public health program of childhood immunization for preventing infectious diseases. Some hepatitis viruses, which cause jaundice, are transmitted through water. There is a vaccine for one of them, hepatitis A, in the market. Summary: the disease-causing microbes enter the body through nose, mouth, the sexual organs, and mosquito bite. An active immune system recruits many cells to affected tissue to kill off the disease-causing microbes. This recruitment process is called inflammation. There are two ways to treat an infectious disease. One would be to reduce the effects of the disease, and other to kill the cause of the disease. There are three limitations of this approach to deal with infectious disease. The first is that once someone has a disease, their body functions are damaged and may never recover completely. The second is that treatment will take time, which means that someone suffering from a disease is likely to be bedridden for some time, even if we can give proper treatment. The third is that the person suffering from an infectious disease can serve as the source from where the infection may spread to other people. That is all in this chapter. Maintain good health and live happy life.